is another exciting study, and it's with Amen, the Adventist, right, smile, and Cindy. The Amen Adventist Medical Evangelism Network, and they provide free healthcare clinics. And so I have served on a couple of those. It's wonderful. They get, they do them before GC. And so, all right, we'll just use that. So they have they do wonderful things. We're just going to have two on here. All right. So I connected with Nicole, and they're actually located in Chattanooga. And so I'm like, hey, let's do some research together. So she is living this because she's actually at an Amen clinic today. And so up in Ohio, so she's not able to be here.
So I'm going to talk a little bit about the background. It is more blessed to give it than to receive, Acts 20:35. This principle reflects belief in humans have an innate design to serve and support others. Jesus exemplified this through his servant leadership, selfless acts, ultimately giving his life for humanity so we could receive a free gift of salvation. In this context, volunteerism becomes a meaningful expression of sharing God's love and grace within the community. To examine the impact of volunteerism, this study focuses on the Amen Free Clinics, a nonprofit organization that provides free healthcare services. Originally established in 2005 by a group of medical doctors and dentists at the Adventist as the Adventist Medical Evangelism Network that they now call Amen. The organization later developed Amen Free Clinics as a dedicated outreach. For more than a decade, these clinics have served communities and addressing the significant need for accessible medical, dental, and vision care among the underserved and underinsured population. Research has shown that volunteerism offers numerous benefits, including increased life satisfaction among adult volunteers and broader physical, psychosocial, and social advantages. The Amen Free Clinic exemplifies these benefits through their partnerships with churches to deliver free healthcare services. Volunteers across the country contribute their time and expertise to meet the needs of community members. Services offered at these clinics include dental care, extractions, fillings, eye examinations, and actually prescriptions where individuals can come back to the churches to pick up their glasses when they come in, to continue that care into the community. This study explores the lived experience of volunteers at the Amen clinics, focusing on their perceptions and their personal impact of their service.
And this picture is actually the Amen clinic that was in Battle Creek, at Battle Creek Academy, at the first weekend in November. And Kurt Vanderwall with AHSRA, Kurt and I actually went to elementary school together. He was, a year or two older, but anyway, he was 3 years older than me in my cousin's grade, but it was cool. So this is BCA gymnasium, and they had, 100 chairs set up there. It's just an amazing thing. All right, so for our methodology, we used a mixed method design, and we had the convenient sample of there are 30 adults who participated. After the Amen clinics, we send out a survey. We have actually just started this within the last 3 months, whatever season we're in. And so anyway, so we got IRB approval. And so we are collaborating on this. We used Google Forms and we did descriptive statistics on the quantitative data and thematic analysis on the qualitative data.
So to look at the sample, 30%, about 10% were male and remaining 90% were female. So of all of these, so that, we have over half were Black or African American, and about a third of those, a fourth of those were white or Latino, and we had some other mixtures in there. Looking at the licensures and the titles to carry, we have PAs and MD doctors, a few of those, but mostly we have nurses and other healthcare professionals. The household income that's mostly they're having is above 50,000. You can see that there are some that are over 200,000, but most of the majority, 24 of our 30, are within 150 or 100,000. Too close.
Yeah, it's the. You're good.
There were some expenses involved, but the expenses were down to really only about $230 per person. That included food, travel, and additional wages. We wanted to get more information from our volunteers. We're asking them the question, do they feel blessed with volunteering? Does it outweigh the expenses? Maybe that's expensive, money and time, because that is an investment that these healthcare professionals, probably more than the money, they invest their time. And the overwhelming majority are saying yes, that it is definitely worth it. How likely are you to serve at another AMN clinic? They're very likely, over 80%. Somewhat likely, even that is going to be another 10%. So we're right at 90%, either very likely or likely to participate in another AMN clinic. How blessed do you feel? By far the majority were very blessed. There was somewhat blessed and blessed, but look, very blessed to put that in there. Thought it was very valuable for us.
So a patient interaction blessing. So that's what we asked. So what did you have an interaction with a patient that was a blessing? So one person said showing up in a therapeutic and Christ-like manner and seeing the expression of gratitude is very satisfying. The blessing of being able to share information on prevention of disease and praying with them. Mental health, working with children and adolescents, listening to patients. Sometimes they only need to be heard or receive a hug. And I enjoyed interacting with the guests as part of hospitality. And, it was just so nice. And so one thing, we have each person at the Amen, they would have the one before GC, because they were in St. Louis, the month before GC, they had a free clinic. There was 2,000 volunteers that came. I tried like the Dickens to get them to collaborate on the study. I stalked them like let's do this. They just, had a process and they couldn't. So, but it was just such a good thing because each person had a helper. So there was a patient and a hospitality person to walk them to the next station, because they had a medical station, a dental station, a vision station. They had a women's health station that was like half a mile away down the same building. And so that way people didn't get lost. And they were taken and they got to interact with the patients while they're walking. So I just want to put a plug out. They need lots of help. It's not just nurses and doctors. They need anyone. Okay. And so as Christians, it is imperative that we share God's love and grace with those in whom we come in contact with, because we're planting those seeds of God's love And it is important to serve and give back to our community. Jesus is coming back very soon, and this is one way you can connect with people, because these are underserved. I mean, let me tell you, there was all kinds of smells, homeless people in there, and such a blessing. My dad gave me some money. He's like, and it was, so I gave it to the runners. I'm like, I was in my joy, I was in data. So they had me at the computer. And so I gave it to the runners. I'm like, if you see someone when they're leaving, here's $50. And so it was just such a good thing, because that can make a big impact. Here we've given them free medical care. They were getting teeth fixed, glasses, such a good thing. So serving at free clinics is a wonderful way to share God's love. So here's actually where Nicole is right now this is the free clinic in Beaver Creek, Ohio. So this is the link, amenfreeclinic.org. And they have free clinics every month. So there's one in Niles up in Michigan. Our references and our contact, but I just want to put a plug in. So feel free it's a good organization. And that is it for us. We conclude our presentation.
Any questions?
Yeah, the other group never showed. So any questions?
So on the bar graph that showed the majority was other. So would that be a lot of the non-medical staff, like the ones who are runners?
Absolutely, yes. So for the GC one, it was Amen and Pathway to Health. They joined together, and Adventist World Radio was there. And I mean, it was just, they need pastors, because for the big ones, they have a whole spiritual care at the end. They pray, they pray with people. And so there's the preachers. They even had a beautician, someone cutting hair there. And
that's
she
great.
was busy the whole time. Even at the one at Battle Creek, they had a beautician there cutting hair, and just it's wonderful. They had massage therapists you could get a 5-minute chair massage, and I mean, just such a blessing. What a neat thing for all these people to come together. There are 2,000 volunteers there because it was a week long, the week before GC or the month before GC, and so just an amazing thing. So they'll come to the area. Nicole lives here. This is their headquarters here. And Pathway to Health headquarters is in Chattanooga also. Betty Garver. I think some of there's a connection. I don't exactly know what it is, but anyways, they're in Chattanooga. So any other questions? Andrew, Cindy, y'all are the only ones not on the panel. Not on the presenting team. Anything?
So I had a
Thankful we're
question
done.
about the first presentation.
Yes.
What were the primary motivators for the students who went on the short term trips? And let's start with that, and I might have a follow-up, but what were their motivators?
Well, at Southern for our short term, what our tagline is, every major has a mission. And so we tried to provide a variety of activities. So one example was we just had a trip that finished in Dominican Republic in partnership with Miracle Volunteers International. And it was open to any student, but we did target the construction management. And we also had a BBS. We also spoke to and so for us in a short term, it's open to everyone, but we are trying to help them align their vocational calling with a short-term mission experience, hoping that it will also spark an interest in them sharing that long-term, but it is open to anyone.
Are you finding that certain students with certain characteristics seem to be the ones signing up for the trips or going regularly on trips? And if so, how do you expand beyond the same people signing up to kind of be more expansive and inclusive of students, and possibly majors might help decide this, but who are more hesitant to go and kind of encouraging them to get in. Because one thing I found is you go on one trip, you want to go on more trips. And so then those trips fill up with people who've already gone. And so there might be less.
Great question. What I think of is what Sergo said, that word of mouth is really important. When you come back, you also want to share with your friends and your peers the impact it had on you. And that word of mouth is worth more than any other kind of recruitment we could have. Additionally, on one of our trips to fill it, we did have a referral program where we said, if you bring someone with you, then there'll be a discount on their trip and on yours. But that was our experience.
Do you find any barriers to, that for students to go on the trips?
The cost is
Cost is the huge one. Anything beyond financial that
timing. I would say also timing. So our short-term mission
Visas also some international students cannot go.
yes, especially in this environment right now, domestic trip would be helpful for to a territory like Puerto Rico might be helpful.
Yes, some regional ones.
Thank you. I'll give others opportunity to ask questions to Dominic.
Any other questions? Thank you. That